talking about the last relationship, um, velocity and flow rate and cross-sectional area. How are they related? So before we go into this, let's look at V. V is velocity, Q is the flow, as you now know, over cross-sectional area. You will have more velocity of fluid if you have more fluid. Very straightforward. You have your velocity with cross-sectional area is tricky. If the surface area is more, so for example, just quickly think about a source of water which is coming out of a tap, and the tube then that comes out with that is connected to your tap is one tube. You turn on the tap, the velocity of fluid is straightforward. The more water is in this tube, the more velocity. Okay. Now, in the same example, in front of the tube, connected with a collection of tubes, say 10 tubes. So in this tube of water, which is connected to your tap, at the far end of it, the open end, you connect it with a collection of 10 small tubes. Okay. So what you've done is basically you have increased the surface area of this fluid. Now, the velocity in the single tube will be the same when you now repeat the experiment. However, as soon as they hit these 10 tubes and the water distributes amongst these 10 tubes, the velocity will drop. You can quickly, very quickly connect it. Why we are even discussing this is when a big artery leads to its tributaries, the arterioles, and the arterioles then especially lead to the many capillary networks, the velocity drops. So from the aorta right down to the capillary networks, you have a drop of velocity. The most drop in velocity is at the capillary level. You don't, it makes sense because you don't want fluid, blood gushing through the capillaries, hastening past the tissues it's supposed to give oxygen to and give nutrients to and take their carbon dioxide and whatnot. So velocity needs to be dropped. So that's an important point. Um, it's further 2 points is if you were to fix the surface area, then V will be directly proportional to Q, something we've discussed. In a variable surface area, this would be applicable. This is important. So in a variable surface area, in an artery, for example, artery at rest is letting a certain amount of fluid to go through at a certain velocity. Now you constrict that artery. You have decreased the surface area. Okay, so V in narrow tubes increases. Right? V in narrow tubes increases, but the amount decreases. Okay? And in wider tubes, just as we mentioned, in big tubes, it decreases. The velocity decreases. This is a very common everyday example. It's really straightforward, but it has very wide, very important implications in clinical medicine. So this is how velocity depends on flow rate and cross-sectional area.